Good morning or good afternoon, everyone. We are very happy to host this webinar. We're going to wait a couple of minutes till everyone is getting connected, as usual. So until 1 or 2 minutes. And meanwhile, I'm going to share my screen in which I will try to introduce the concept of a poll in which you'll be able to select which topic you are the most interested in. Basically, we're going to present globally what we've presented to MPS and then try to focus into the most suitable application that whoever wants to be more focused on. Okay, so while waiting for everybody to connect, please, we're going to launch the poll and you can choose between a couple of options and eventually suggest some topiks we'd like to go deeper into the details. Okay, thank you so much for choosing voting. There's a lot of topic of interest, and while the staff is gonna assemble the next slide for the second more focused application, I'm gonna introduce more NetTree and what we do, and just go into the deeper subject of what we introduced into at MPS. I hope, by the way, that you all had a fantastic event as much as we did. We believe and we share that with the organization steering committee in which NetTree is part of, and we hope that in Brussels it will be a fantastic event next year. So to put it in a nutshell, we are NetTree is an organ chip company in France. We are based in Lyon. We produce organ chip and exploit them as a service also. 34 people, and we got to move into the next generation web production site in October. So the idea behind organ chips, you all know that, but particularly into NetTree, is that we want to reproduce the natural compartmentalization that is underlined of several organs, but especially focus into innervation. How we do that? We create compartments using microfluidic channels that are separated by very small channels that are 3 micron high, in which only axons or dendroids can sprout from one compartment to the other one. So this is a schematic view. All our chips are designed into this 96 well plate SBS format, the classical petri dishes, and all the fluidic part is underneath, as you can see here. Per our minimum production unit, it's what we call the quarter bento, in which you have 4 individual chips that are all assembled into the neo bento format. That is, as you can see, 96 well plate alignment, ready to use, compatible with most fluorescence or luminofluorescence capacity, high throughput, also microscopy. We are also making 3D reconstruction of compartmentalization using our duplex line. And you can see here, this is consistent in an open well in which you can place a 3D explant, an organoid, separated by a nanoporous membrane or microporous membrane to a microfluidic channel here in which you can place endothelial cells to make vascularization. And by combining both, we can recapitulate both innervation and vascularization. And all our devices are designed in this 96 well plate format. So when we zoom in our culture system, you can see that you can, in this particular picture, you have sensory neurons, somas that are placed on one compartment, and all the projection are done in the other compartment. And you can apply a compound or molecules or a virus into one compartment only, so soma or neurites, and without touching the other compartments by fluidic isolations. Our particular system, in which we want to record electrophysiological aspects of the functional activity of neurons, is by combining sheets with Axon Biosystem compatible devices. So Axon Biosystem is one of the leader of electrophysiological recording, and you can see we have produced our MEA capable devices by combining both electrodes and compartmentalization of microfluidics. This gives us our neo-bento MEA line that is either for 2D or 3D recording. So this is an example of an application that we promote when you have any organ on one side that are innervated by any neurons. And you can see this in particular example, it's human keratinocytes that are innervated with human sensory neurons. The fluidic isolation between the two compartments allows us to use separately or conjointly cell media culture of one organ only, or differentiation factors into the human neurons only. And eventually, when coupled with multi-electrode arrays, you are able to place an ingredient or drug on one compartment only and record the electrical effect of onto the neuronal somas or directly underneath the microfluidic channels where electrodes are placed. By leverage the different impact of an ingredient of a compound, we are able to extract what we call a digital signature of a compound when placed in this particular configuration. And when you screen a lot of different molecules that are being on the market or failed in clinical trials, or reference molecules that are known into a specific application, you're able to extract a lot of digital data out of the neural response and to plug that into our digital library system. I will go further into the detail later. So we can innovate any organs and look at the targeted biology, the targeted response of any compound into a specific organ. And again, in a high throughput manner, because all our devices are designed to be compatible with high throughput system, in which you can stack them without any pumping system, and when you can dispense liquid every 2 or 3 days, as the model required. So a couple of examples of electrical recording and what we can do into our devices. This for the 2D innervation culture system, you can see an example of a raw data recording when you place a compound into what we call the fast acting, where you can actually record in real time the effect of a compound, and you can see the recovery of the entire neuronal system. We place a high level of quality control of our chips using this new readout. When we can, before application of the compound, you can see how active are the neurons and how effective they can respond to an organ, to the compound. You can also see this an example of a lidocaine exposure directly in real time. You can see before the application for 3 minutes and after lidocaine exposure and after washing. An example here of gluta GABA neurons, in which you can place, for example, A-beta 42 on GABAergic neuron and look at the influence of what's happening into the gluta side. Couple of examples that we have published, and eventually, if you like, you can download our latest papers into our website. Oncology with pediatric glioblastoma cell lines, in which we have placed glioblastoma on the neurite compartment and record how the gluta cells are affected. We've shown that by activating activating the glial cells line with LPS, you have a significant impact on the electrical activity of neurons. And by trying several chemotherapies, you can reduce the proliferation of the glioma cell lines while maintaining the global electrical activity. In immunology also, we have activated, placed several cell line activated cell lines into the synaptic compartment only that is placed here. And you can see the difference between those chips is that this compartment here is a little bit shifted relatively to the center of this one. And this allows us to create a pure synaptic compartment, because it happens that in our devices, dendrites will not sprout more than 150 micrometers into the microchannel. So by shifting the center channel, we're able to maximize the number of dendrites here and create here real axons propagation, and you can access to a prosynaptic compartment. In this study, we've shown that activated cells have a significant impact if they are in the middle channel, so located into the synapse, and if they are activated or not, with a functional transmission from cell body to the other one. Just a peek into our sensory neurons, where you can see that. So this is the same. There's a little bit here. Sorry about that. There's human keratinocyte on the other side, innervated by sensory neurons, and you can see that we can record a direct response of a certain reference compounds, and also the chronic response for long time exposure up to 7 days. And in this particular study that we've made with a client, we've shown that we are able to measure oxytocin-like effect for up to 7 days. We are also currently developing this dual link well, in which you can even not only place 2D cell culture, but even innovate any 3D cell culture with this open well, for example, for biopsies or for 3D organoids. This could be very helpful for innovation and could connect it to neuronal channels with placing electrode underneath. About a 3D application. So this is our brand new line that we are able to commercialize since last month. Our duplex system allows us to create a mini transwell in which you have an open well in the red dot, and with underneath you have a microfluidic channel in blue. This is a 3D stack, and we have shown that we can successfully cultivate human endothelial cells in the blue channel with a tight cell junction, because we are able to control the shear stress into this microfluidic device by using either rocking system or a small perfusing system, again without tubes. In this particular example, we've shown that when cultivating human skins or keratinocytes on the top of the HDMEC, we're able to have a different shape of the HDMEC, thanks for the sprouting of compounds that are secreted by the keratinocyte just underneath the endothelial cells. We are also currently making a study with the CEA in Paris for cultivation of human brain organoids. And in this particular study, we have shown that by using our duplex system, we're able to enhance the reproducibility rates by twofolds with our culture system. How does it work? So there's no endothelial cells in this particular experiment, but since we perfuse the organoid by the central channel with the nanoporous membrane, we'll never touch and we'll never express shear stress on the brain organoid itself. And we have showed among a lot of different number of replicas that we have a very small variability compared to classical 96-well cultivation of brain organoids, which, as you can see, show up to 3 months cultivation into the system and 4 millimeters sprayed without any necrosis inside. And this particular system can be applied to any type of organoids. And we have liver, kidney, and tumoroids. Well, now in the future, we all, and this is what we presented actually at MPS in a real format. We've introduced what we call the multi-organoid system by innervation and vascularization. So we take the same duplex system here, and we place our microchannel technology on the side, which allows us to, on the cross section, to innervate an organ while making the vascularization. This particular chips will be able to for purchase by the end of July. Now, what we want is to connect several organs together, and we want to avoid any tubing or any complex system that will prevent us to go to high throughput. So we developed this patented jumper system that consists in a double valving system. While when we aspirate air by this entry, you're able to suck the air that is underneath here, and then you push air that will be pushing on the other side. Meaning that basically you just need to aspirate and to push air to make this flow happening from one organ to the other one. The good stuff is that it's all normalized with a 96-well-like system, so you can really compose the different connectivity pattern that you'd like between the different organs. Those particular jumpers are activated by this perfusing system that is conjointly developed with Seabird and Netri, in which all the jumpers, the configuration will be in this local gasket here, and that will be directly pluggable into the dual link well system for an operational 1 organoid, 2, or up to 4 organoids in a closed loop system or in an open system, so that you can inject and take out some liquid if you like. This particular system will be available for beta testing by the end of the year. And if you have an interest in going deeper into this system and to be part of our beta testing program, we'll be more than happy to show your interest. Eventually, we are also planning into integrating fully functional multi-electrode arrays into this 3D system. So both into the neuronal compartment, so that we can probe and use our digital signature approaches for one organ, but here to extend it to all the different organs connected. And we are really heading and planning to find partners and to apply this new system into a full ADME multi-organ system with either tumor or blood-brain barrier coupled to our cerebral organs. So thank you for this first part. I tried to make a very overview of what all we've presented at MPS, and I guess now we are going to switch to the more full presentation that you've selected, and if it's going to work. Oh yeah, well, this is the blah blah about the preclinical and where we are positioning. Okay, so it seems that you want to go into more biopharma general applications. So the team has assembled some couple of slides. I'm actually discovering in real time which presentation has been chosen. Okay, so let's focus into more MEA related application about how we can go deeper into extracting using the neurons as a sensor approach to extract more data. Okay, so as you know, all the organs into the human body are innervated with different type of neurons. Obviously, most of them are in the spinal cord, especially in the root dorsal ganglia. So that are mainly sensory neurons. For example, the gut is innervated by vagus nerve, but you have also different pathway like the directly gut-brain axis, but also the secondary brain axis with the BBB and the vascularization system. So as you can see, we are able to use the neurons as a specific sensor that allows us to have a dynamic insight of what's happening into an organ. And again, everything is here into the projection of the neurons to get you a pretty much sense of what's going on, inflammatory response, or any other type of response, especially for the skin, pressure, mechanosensitive response. So before going into the neurons, be reassured that all our devices are compatible with the most classical recording or readouts that you can use. It's basically a smart Petri dish. So you can definitely correlate any type of natural readouts, ELISA, LCMS, light and imaging, or specific imaging immunofluorescence with all the multi-electrode arrays. And we have, just to mention, for our barrier system, we have also the capacity to integrate tear measurements with our partnership WPI. Again, it's the same spirit than NetTree. We want it to be as simple as possible. So it's a little system that you plug on the top and you're able to record in real time the integrity of the barrier using tear. So a couple of examples of what we can do, again, a little bit more detail. So directionally sensorial neural projection in our different system. And as I showed you before, this shifted devices that allows you to make a pure synaptic connection in the middle, or a directional synaptic connectivity from one compartment to the other one. Now, a couple of examples, CIPN. So on the pure imaging system, we have seeded some sensory neural cells from our partner Axels, and we've tried paclitaxel on only the neurites and oxaliplatin on only the cell body. As you can see, we have measured the dose response, and we have measured a significant destruction of the neurite themselves, even if it's on the cell body. So that proves us that compartmentalization has an effect because there's no fluidic leakage from one compartment to the other one. And we've measured that on the other side, on another study also. So take-home message, you can make those responses into the devices on one compartment only and see if a target specifically, a compound target specifically neuron soma or distal axons. If we're going to focus into the MEA system, so we have two versions of the MEA. A lighter one compatible with the Maestro Edge, so for 8 independent compartments. And again, those little guys here, this plug-in system can be taken off, but they can be replaced by other non-MEA quarter bentos that we sell. But those are here to maintain a high level of humidity into the entire system. And we also have a Pro version for 16 independent chips. Now, the philosophy behind the way we want to approach, it's not to create fully complex co-culture system as per se, because we believe that the first step to initialize the database, the digital signature database, is to try a lot of different compounds that you may be interested in directly on the neurite compartments of the neurons. Again, we culture in our automated system a lot of different replicas of neurons, and sometimes it's not even you can have really easy and de-risked results without the co-culture system that may be in certain cases complex to have or complex to achieve if you're on a specific organ. So what we suggest is that you go from neurons only, and to add eventually a supernatant that can be act as an injury. For example, for Alzheimer's, we use A-beta-42 or Parkinson alpha-synuclein, but before going into the fully co-culture system. And most of the time, we see that the advantage of using the co-culture by the processing of the targeted cells or the targeted organ before and after the neurons. So it's from one step to the other one, ready-to-use assays to more complex systems that you can co-develop together or directly with your team. So we want to make a high level of reproducible data. So that's why we systematically characterize, and we've developed a methodology to characterize all our cells, and especially neural cells, into a device. As you can see, we look at all the different expressed markers. And this is the cells from Axel's system, neuron sensory cells, and also the electrical activity recording once they are mature enough. We did the same stuff with motor neurons, for example, with FCDI, and with all our different partners and all the different batches that they give us. About the quality control, so we use the power of multi-electrode rays and electrophysiology to measure the electrical activity of our sensors, which are neurons, directly before application of the targeted compound. Because again, we want to have the most repeatable results. And before application, we can exclude a certain amount of devices in which the cell culture may have failed and may not pass a quality control. So we have now, as you can see in this particular graph, we have now screened quite a number of batches and of different cell providers, and we know that if we want to have a significant results out of this specific application of the compound, we need to retain this batch before application. So we put into the organoid space a kind of quality controlling test that is non-destructive. So if you want to look focus a little bit more into our neuron as a sensor approach, into all the different biopharma application and whatever the targeted organ, we want to look at the absolute state of we do not want to look at the absolute state of a culture. Basically, our hypothesis and our approach is to say that whatever the response of the neurons, because neurons will we've always flash into a targeted organ, but we don't know what is the human baseline. So we always want to look at the differences between and the changes of the state within the same culture. And we apply a compound on injury before and after application of the baselines. And we look at the change of states into different variables, and we have up to 42 variables achievable into electrophysical recording. So let me give you some example. We have two ways of applying a compound, as I showed before. The slow-acting response method, in which we record the same culture at different timeline, and we've been up to 7 days, as I mentioned you. So we look at the altered states results expressed in the percentage of change in this particular case, mean firing rate, which is how fast the neurons will burst. Or we look at the fast-acting response methodology, in which we look at in real time at the direct application of a response, and we have directly in the same culture, the vehicle, the compound, and the positive control. And we look at the results expressed after full change into the mean firing rate in this particular application. So this will give us an insight on the mode of action of a specific compounds into an organ using neurons in an acute or a chronic exposure way. And that can be done at the same culture. Some example with the sensory calibration. So we've tested the classical compounds or effect as temperature. So we have cracked the code of the encoding of the temperature into sensory neurons, and you can see a significant change of fold into application of 32 degrees or 41 degrees only on the sensory compartments of the neurite comparison part. What is more interesting in this application is that you see that when you look at in real time, this particular variable, the mean firing rate, will not change suddenly, and we have a lower slowdown responses while encoding 41 degrees or 37 degrees. And this gives us an insight of how compounds that may have an effect on temperature-like targets, like menthol, for example, have a comparison with the natural effect of temperature. We've also looked at the effect of propionate in LPS, and you can see we can monitor the significant amount of changes with different type of impact. And also, as I mentioned before, lidocaine. And this we've done that with four client compounds. Compared that to 4 different compounds that seems to have the same effect as propionate, LPS, and lidocaine. Another example, so I've shown you before our imaging capacity with paclitaxel, and you can see that we've correlated those images with multi-electrode recording, and you can indeed see that in the same ideas than shown you before, you can have a significant difference between the mean firing rate of paclitaxel with those responses, CAPS-like effect also with only neurons, and positive control of KCL, propionate or ATP in this particular example, where you can see that between the baseline and when you activate with ATP, you have a significant changes. And this was done with the supernatant of a specific extraction of a bacteria of one of our clients. So that being said, we've looked at the mean firing rate, but definitely we know that the mean firing rate is not the only variable that you can extract from cell culture, and we know that it's not discriminating. It means that you don't have the bijectivity necessary to, once you have the only mean firing rate, you cannot come back to the compound that you are targeted, or do you want to know if the mode of action is close to a specific compound. That's why we need to go into more deeper insights and variables that you can extract with this digital signature. So to show you here, thanks to our friend and Axion's biosystem, but also to all our computational neuroscience that we have in-house, we're able to extract approximately 42 different electrophysical variables within the entire chip, but also within the channel 1, the channel 2, and the channel 2, but also the microchannels themselves. So that makes a lot of metrics that you can extract, and it's very complex for the human brain, or to our comprehension right now, to see which is the discriminating variables that will be able to, again, make the bijectivity between the compound and the digital signature. That's why we believe that we can choose right now. So we have set up a way to, as I mentioned before, for all the different channels, to look at the altered change in the fold magnitude between all the different metrics. We assemble all those different changes into all the different pattern configuration between channel 1, channel 2, channel 3, because the state that we are looking at, it's altered anytime, and we want to have a big picture of what's happening in the somas, in the microchannels, so on the axons themselves, or at the endings. So we sum everything up, and we come up with what we called a QR code, which is the real state of the digital signature of the altered state because the reference state. This code is kind of very important because that will gives us a very picture of what is applied on which targeted cell culture or cell co-culture, and without any choosing or any bias into the choosing of the variables we are looking at. So we have a global picture. Now, when we look at all the different variables that you're looking, you can see that you can compute that some of those variables are dependent on one on each other. So when you have this matrix, you can see, so the darker those correlation between those variables are, the lower correlated they are together. So we apply a threshold, and we have, for a certain state of experiments, we have the capacity to say that we can look at the variables that are the most decorrelated from each other. And when you do that into specific application that we've shown, we've seen that you can, for example, in this particular example I showed before, discriminate with two decorated variables the population in which the responds to 41 degrees and the one that are agonists. And this methodology allows us to make several population and to target that if we have a compound that has the same number of spikes normal change relative to the in situ with burst normalization change, you'll be able to locate and to say with a certain degree of confidence of confidentiality that the targeted compound will have the same mode of action of a 41-degree exposure. Now, if it's not discriminating enough, we're able to go up to all those different variables and to have this 2D mapping of the digital signature, and to be discriminating by the shape of the digital signature. Again, those work is very preliminary. We have set up the methodology, and now we are looking for partners that will help us to screen a lot of compounds that will go in whatever biopharma application, by the way, as long as there's sensory neurons or vagus neurons or different type of neurons that are implicated and innervated in an organ, and after to switch into the co-culture system. Well, thank you so much. I believe I've been a little bit short, but we are able and open to questions. The business team told me that by looking at the webinar, you'll be able to have some discount on the website, classical, but feel free to order some chips during this summer sale. And I'll be more than happy to look at your questions. So let's go for it. Okay. Okay, so far I haven't got any questions. Feel free. I believe I've been this clear. We'll send you the link of the replay and the slides. Feel free to share it with your teams. We have another webinar in a week, so if you can push the webinar to your teams or to fellows scientists that may be involved into our approaches. So I have a question. You talk about CIPN and platic-XL, but is oxaliplatin inducing acute hyperactivity like platic-XL? So we've measured hyperactivity induced. We are currently working on that. It's kind of challenging because hyperactivity is also focused into certain type of receptors on the sensory neurons. But yes, we are actually working on this right now. So we'll be able to send you some data if you'd like. Would other type of neuropathy be possible to study with MEA? I believe so. So neuropathy, and I need to probably be more specific, but we are currently going into multiple sclerosis with, for example, reproducing the myelinization of axons. So this will be done into a trailing system in which you can place a full Schwann cells population in the middle, and you can record the conductivity velocimetry when inducing a generation of myelinization. We are also going into Charcot-Marie Tooth disease, IBD, if it's close to neuropathy, or even other type of disruption of the myelinization. How scalable is the organ-on-chip technology for high throughput screening? So again, we don't use any pumping system. We want those systems to be as compatible as possible to high content screening platform like lab automation system. So basically today we are able to cultivate in the same timing up to 340 several data points for 3 weeks in the same time of window. And again, this is all done into our lab automation system. That is a Beckman IGO, but you will know that people have been doing that into our molecular devices or TechOn system. It's all about programming the cell culture protocol. So, and it's pretty much robust in terms of repeatability. So if you're more interested, please feel free to contact us and we'll give you some data on it. Another question: how do you envisage the integration of this technology into current drug development pipelines? So indeed, there's a critical aspect of this technology today. We our customers integrate our preclinical data set into their IND filing. As long as we provide the methodology of cell culture, of innovation, of data extraction, it's done at ease, and our team now has the background to know what needs to be placed inside those IND file submission. However, we are going into also more clinical data acquisition in terms that some of our customers ask us to make what we call cohort on chip, in which we extract the IPS of patients that are in the cohort, and we make this double twin system in which we address other type of questions, that not only clinical readouts. So, for an example, in Charcot-Marie Tooth, we look at the conductivity velocimetry that is very difficult to record into clinical trials, into a pain model. We also make digital twin, or digital avatar with our digital signature to assess the pain of a compound relatively to the same type of phenotype of the cohort on the chips. So not only from discovery point of view, when you can anticipate, and this is more what we call when we want to kill quickly a compound if it's going to induce pain, for example, in CIPN. In preclinical, it's more about looking at safety and efficacy of and mode of action of a compound relatively to another one that is known, or reference compound that's classically known on the market, or in clinical trials for cohort on chips. Another last question about the perfusion setup. I did not fully understand. How does it work? Is it possible to have continuous flow rates or specific pattern in your culture? Yes, so sorry if I've been a little bit quick on the explanation. Basically, you place a system that pushes one flow, the liquid that is under one duplex system to another one by aspirating and pushing the air from one to the other one. So yes, you can achieve continuous flow. You can achieve a continuous flow between several organs, and also in control shear stress upon the flow velocity. You can apply also a specific pattern to a culture if you want to leave an exposure of the liquid that is just underneath an organ, you can leave it for a while and have to push it to another organ and leave it for a while. So this is all programmation of the perfusing system. Again, you can also not only place into a closed loop, so round circle of different organ. You can also place it on an open loop. So you have the inlet directly onto the chip. It's always like that. The inlet that goes for 4 organs and the outlet. So you can extract what is. You can still expose gut, liver, kidney, and targeted organ. You can expose the entire system, but push new media or extract the media that is in the loop. Have you tested to maintain cerebral organoids for longer period of time in the duplex? Yes, we've been up to 4 months, and we can send you the poster that we've exposed at MPS that will show the data sets. And we've been up to 4 months because we didn't want it to well, it was lack of interest into a specific experiment. Okay, I believe there's no other questions for now a while since I was responding. Thank you again so much for the time. I hope this was helpful. Please again feel free to contact us onto our website, by our website or directly. Again, we'll be more than happy to host you in a week or fellows scientists, and looking forward welcoming you in the NeuroFluidic community, either by using our devices or services at Netry. Thank you so much. Have a wonderful day or evening.